New Mexico health officials are now questioning the usefulness of antibody testing. News 13's Gabrielle Burkhart spoke with the state doctor who is helping guide New Mexico through this pandemic.
State health officials were hoping the antibody test would provide key information to safely reopen the economy. But Dr. David SCRASE of the Human Services Department says today there are still more questions than answers.
I really worry that consumers and your listeners will spend $50 or $100 for something that really doesn't give them any more real information. And in particular, knowing whether you have COVID antibodies or not does not change anything that you would do or should do.
Right now, the state health department does endorse testing at certain places like TriCore and Quest labs. Dr. SCRASE says those tests have proven to be accurate, whereas some mail-order tests on the market are not approved by the FDA and results cannot be tracked by the state. An antibody test is different than a diagnostic test. It's a quick blood draw that can show if you previously had COVID-19 and didn't know it. Health departments hope to use that information to get a better picture of how the virus has spread through communities. But part of the problem, SCRASE says, is doctors still don't know whether having antibodies makes you immune to COVID-19, and if so, for how long.
You know, in mumps, those antibodies aren't generally protective. We also don't know how long it lasts. So like for influenza, we all get a little protection from influenza, but that wears off over time, which is why we all have to get an influenza vaccine pretty much every year.
Now, labs like TriCore and Quest are taking antibody tests for those with a doctor's referral. Otherwise, you can pay for and order the test. Those labs have disclaimers on their website that antibody testing results should not be used to make decisions like return to work policies or any decreased need for protective equipment. Back to you.
Okay, thanks, Gabby. Now, Dr. SCRASE says it is possible New Mexico will do more antibody testing in certain parts of the state, but they first need more reliable tests. You can watch that full interview with Dr. SCRASE at KRQE.com.